Good morning and welcome from New York City to everyone who is logged on to this webinar. My name is Zara Rizvi and I am the Senior Livelihoods Officer at the Women's Refugee Commission. Today's webinar that you've logged into is titled Peril or Protection, Making Work Safe, and we will be looking in depth at the intersection of gender-based violence and livelihoods. Before we begin, there is some housekeeping to get through, as this may be the first time people are logging onto a webinar or have used a different platform when looking at other webinars. If you are having technical difficulties with the audio, etc., let us know using the chat function, which you'll see is on the right-hand side of the webinar screen. All you have to do is type in your question and hit submit. We have the lovely Kelsey and Caitlin, actually, from Social Media Today helping us out. Thanks, guys. So hopefully they'll be able to assist you with any technical difficulty issues that you may be having. The webinar is an hour long. It'll be approximately 25 to 30 minutes of presentations from our two expert panelists, whom I will introduce you to in a minute, and then we will open up for questions and discussion from the participants, you guys, who are all logged in. You can ask questions on an ongoing basis, again, using the chat function I just mentioned on the right-hand side of your webinar screen, and I will consolidate these and bring them up for the panelists in the second half of the webinar. We would like this to be as interactive as possible, so we will have some polls for you, and the presenters may also be throwing out questions and things for you to think about and respond to, and for us to discuss further in the Q&A part of the webinar. When asking questions, it will be great if you could just identify yourself. You can give us your name, agency, location, what you do. Any of that stuff we'll take. It'll be great to know who we're interacting with. The webinar will also be recorded, so you'll be able to find it on our website in a day or two. And all the slides and everything that you see in this webinar, all of that will be included. I think that about covers our housekeeping topics, and we'd like to start with two quick polls for the participants who are logged in. The first question we have for you is, you can see it on your screen right now, is gender-based violence a problem where you work? You can just click, like just right on your screen, you can click either on the yes or the no, and that will move you on to our next question that we have for you, which is, just going to wait for the next question to come up, and hopefully that is not our next question. Just give us 1 second. But the next question that we are looking at right there on the screen, you can see, do economic programs targeting the affected populations where you work help make women and girls safer from gender-based violence? So again, all you need to do, a simple yes or no, just click on what you would like your response to be. And what we'll do is we'll tally up these results from the poll, and I'll share the responses with you right after I introduce our two panelists. We saw that slide already that had our two panelists on it. So I'm going to go ahead and introduce to you our first panelist. Her name is Mendy Marsh. She is based in New York she's based in New York City at the UNICEF headquarters, and she is their GBV specialist in emergencies. Mendy has a master's in public health and a master's in social work from Columbia University in New York. Mendy's career in the development field started over 14 years ago. During this time, she has worked primarily on reproductive health, HIV/AIDS, and GBV. She has worked on GBV in conflict and other disaster-affected countries, primarily in Asia and Africa. She is responsible for providing UNICEF headquarters, regional offices, and country offices with direct technical support on GBV in emergencies to ensure that UNICEF programs are in place to prevent and respond to GBV, and also to ensure that appropriate coordination mechanisms are in place. She also supports UNICEF and other partners on capacity building on GBV prevention and response. She is their main focal point for the co-responsibility that UNICEF has for the GBV area of responsibility under the Global Protection Cluster. Welcome, Mendy. It's great to have you here with us.
Thank you. I'm happy to be here.
Excellent. The second presenter, you can see his photograph, and I have the great pleasure of working with him over here at the Women's Refugee Commission. It's Dale Boucher. He's the Senior Director of Programs. Dale leads the Commission's work on refugee livelihoods, youth, gender, and disabilities, and he oversees our work in where am I? And he oversees the Commission's work on sexual and reproductive health and detention and asylum. He has been working in the refugee assistance field since 1988 in a variety of capacities, including with Vietnamese boat people in the Philippines, with Haitian refugees interned at Guantanamo Bay, with displaced Kurds in northern Iraq, with Bosnian refugees in Croatia, and with Kosovars in Albania and in Kosovo. He also led the International Catholic Migration Commission's $25 million international programs in 20 countries. He's also worked for the UN High Commissioner for Refugees and wrote the handbook, Operational Protection in Camps in Settlements. Dale has designed and implemented refugee assistance programs covering life-saving services, refugee resettlement and reintegration, and economic recovery. He's written numerous publications and presented at global conferences. He's also an adjunct professor at Columbia University School of International and Public Affairs. He's got a master's degree in social work from the University of Utah and a bachelor's of science degree from Iowa State University. Welcome to you, Dale.
Thank you. I'm happy to be here.
Excellent. So we're going to get into the webinar, the main topic of our webinar very, very quickly, but I just wanted to share the poll results with everyone from our, and there you can see the results right there. From our first poll, we asked, is gender-based violence a problem in the setting where you work? And 61% of you logged on right now did indeed say that it was. The second poll that we had asked about, and the results for that, do economic programs targeting the affected population where you work help make women and girls safer from GBV? And 67% of you said yes, that they do indeed make it safer, which is fantastic to hear. And 33% said no, they don't actually make women and girls safer. You know, it's telling that the results just highlight what we have learned as part of our research at the Women's Commission and highlights the need for webinars such as these. As an overview of what we will be discussing in this webinar, Mendy will first talk about the links between livelihoods and gender-based violence, followed by a quick explanation of how gender-based violence activities or interventions are divided between either prevention or response. Dale will then talk about the work of the Women's Commission in using livelihoods as a tool for protection, which will include a quick walkthrough of the safety mapping tool we have developed that should be of special interest to GBV and livelihood practitioners, or really any practitioners that are implementing in the field. We will then, as I mentioned before, head into a discussion and Q&A session where we look forward to your active participation. And with that, I would like to ask Mendy to lead us through the links between livelihoods and GBV. Over to you, Ms. Marsh.
Thank you. Okay, so what is the link between livelihoods and gender-based violence? We know in conflict settings that as a result of conflict and displacement, women and adolescent girls adopt new strategies to provide for themselves and their families that often put them at greater risk of gender-based violence. Whereas displacement or desperation may affect men and women differently, where men may actually lose their status or their power in their community and within their family, women and adolescent girls take on additional roles and responsibilities. Changes in power and in relationships can lead to positive changes, but they can also lead to increased risk for women and girls, especially when women and girls lack access to safe livelihoods options. When we think about programming for livelihoods, programmers often make assumptions. Assumptions around what we think is going to happen around protecting women and adolescent girls in particular. Some of these assumptions include economic opportunities will actually have positive roll-on effects. Women and girls or older adolescent girls may actually become safer when they have an income, which we think often will lead to having their children be more likely to attend school, be more likely to access health care, and be better fed. But we're going to get into some of these assumptions and see how we really need to analyze our programs to ensure that these efforts really will protect women and girls. So before we do that, we want to think a little bit about what the actual vulnerabilities are in relation to gender-based violence in conflict. There are a number of vulnerabilities to gender-based violence in conflict, These include underlying root causes which are embedded in the social and cultural acceptance of inequalities and discrimination against women and girls. Everyday risk factors that contribute to the risk of gender-based violence can be broken into the following 5 categories. For example, inadequate legal frameworks, which can include things such as persistent impunity, lack of awareness of rights and obligations, lack of basic survival needs, which can lead to risk of sexual exploitation and abuse due to inadequate access to food, non-food items, cooking fuel, access to water, and safe shelter. Lack of economic and social education opportunities, which can lead to financial independence or dependence and income-generating activities that are unsafe and lead to exploitation. Socio-cultural norms, which also impact gender-based violence, including factors that actually lead to displacement, such as domestic violence or harmful practices, such as female genital mutilation or cutting, or early forced marriage. Lastly, insecurity and lack of physical protection, which can lead to increases of gender-based violence due to periods of insecurity during flight or displacement, not having access to appropriate lighting or safe shelters, poor latrines or hygiene facilities that are not separated for males or for females. They may not be lit or lockable from the inside, or actually just being dependent on males for needed information. So what do we do about these situations, and how do we deal with gender-based violence in conflict settings? These activities are generally divided up into 2 large areas. One is prevention and one is response. So we're going to break these down in further detail. When we think about response, response means actually establishing services to mitigate the effects and reduce the likelihood of re-victimization, or set up services to minimize the consequences of gender-based violence, which will actually prevent further harm, injury, or suffering. Experiences from the field have revealed that no single sector or agency can actually address gender-based violence. The multi-sectoral model is generally what we rely on, and which actually forces us to think about the need for interorganizational and intersectoral efforts across the health, social welfare, legal, and security sectors. These efforts must promote participation of the community. They must focus on interdisciplinary work and collaboration among different sectors. A key principle around the multi-sectoral model is the rights and needs of survivors are preeminent in terms of access to respectful and supportive services, guarantees of confidentiality and safety, and the ability to determine the course of action for addressing the gender-based violence incident. In general, in emergency contexts, we tend to focus on the health and psychosocial sectors. And the psychosocial sector is often where we actually bring in the livelihoods efforts to ensure that women and girls have that as a referral option when we're trying to meet their basic needs. So let's think a little bit more about prevention. Prevention activities in many ways are the longer-term efforts that we must actually deal with. They're not necessarily as concrete or as tangible as the response activities. Prevention activities can result in some risk reduction and immediate skill changes in behavior while beginning a process that will encourage long-term social change in social norms and gender. Prevention means that all sectors and actors must take action to address gender-based violence and make sure that anything that they do within their sectors will actually ensure the protection and security of women and girls. While it also means engaging in activities to identify positive social norms that protect women and girls from violence while leveraging social dynamics to change social norms that serve to hide or actually encourage forms of violence. While prevention efforts are improving, up to now the humanitarian community's response has largely focused on response. More specifically, it has focused on service delivery for various reasons. One of the first reasons that in many contexts sexual violence has become so common that we think about it as being inevitable. Another reason is that addressing gender-based violence in humanitarian contexts is still not a donor priority, which forces us to do what we can with very limited resources, and thus response ends up being the large focus. In addition, response activities have also been prioritized because we always have to ensure that we undertake interventions that will have an immediate impact on saving lives, especially from the health and psychosocial perspective. So in general, as we think about how we're going to deal with gender-based violence in emergencies, we know that GBV exists in all communities. This is in contexts that are not actually suffering from instability or conflict, and that to get to the root cause, it's necessary to change gender inequality. gender-based violence is a social problem, and because of this reality, if we are not working towards some sort of social change, we are also always going to be responding to incidents of gender-based violence rather than preventing them. In recent emergency contexts such as Haiti, the Horn of Africa, and the Sahel, gender-based violence has always been a persistent problem in these countries. But as these major emergencies have unfolded, we have consistently seen the problem of gender-based violence against women and girls be exacerbated. In Haiti, for example, sexual violence, including exploitation and abuse, and domestic violence were significantly increased after the earthquake, while in the Horn of Africa, and most recently in the Sahel, we have seen an increase in sexual violence due to women and girls adopting exploitative coping mechanisms to find food for their families, as well as sexual violence, including gang rapes in northern Mali and Somalia, and in camps in Kenya and Ethiopia. In those contexts, we've also seen that early marriages have taken place, where families may be more likely to marry their daughters earlier in an attempt to protect them. To promote women and girls' protection, the humanitarian community must significantly expand its efforts to respond to gender-based violence in emergencies. This includes both prevention and response. In the short term, this means addressing everyday risks through concrete primary prevention-focused interventions, including ensuring that women and older adolescent girls have access to safe livelihoods opportunities, while we continue to work in the long term to address the underlying causes of gender-based violence by changing social norms. And with that, I will hand over to Dale so that he can get into some of the research and the learning that Women's Commission has brought to the fore.
Thank you, Mindy. I'm going to talk first a little bit about some of the research we did looking at the links between gender-based violence and livelihoods, because we've been doing work around livelihoods for a long time, but we wanted to ensure that actually promoting economic opportunities for women and older adolescent girls actually increased their safety and mitigated some of these risks. So we undertook research on gender-based violence and livelihoods in 3 settings. In Kuala Lumpur, in Cairo, 2 urban settings, and in 2 camp settings in the Jijiga region. What we found in our research was, first, through our desk research, there was very weak evidence base on the link between gender-based violence and livelihoods. And what we found in those settings was that many of the livelihood opportunities being implemented for women and young women, even by NGOs, actually increased their exposure and their risk of gender-based violence. Women were entering the public sphere, they were going to markets, they were going on transportation that was not safe, and so we found actually a lot of the economic opportunities were actually heightening the risk women and girls faced. So we found overall that participation in a livelihood program may or may not reduce a woman's risk of gender-based violence by increasing her economic independence and her household decision-making. Does that mean we don't want to create economic opportunities for women and older girls? Of course not. But what we need to do is think through how we make those opportunities as safe as possible. We took some of this learning and did trainings around the world on using livelihoods to mitigate the risk of gender-based violence, bringing together GBV practitioners and economic program people. And what the economic program people told us was, gosh, people told us we were supposed to help people get jobs or earn money. Nobody told us we had to think about their safety at the same time. And many of the GBV practitioners told us, as much as Mindy said, we focused on cultural and social norm change. Nobody's really pushed us to think about how do we operationalize prevention. So one of the things I want you to think about for the discussion that follows is the following question. What have you done in your programs to ensure that economic programs are protective? So I just throw that out there for you all to think about, and we'll come back to that in the Q&A time. And if you have responses to that, clearly you can start putting them in the chat line already. So because we've done this research, we also wanted to say, okay, economic program people often haven't thought about this. How do we help them think through how to make their programs safer? So we developed a tool that focuses on doing a protection assessment, which I am going to walk you through. That tool has several pieces to it. It starts with secondary research, includes safety mapping, a safety tool, and a decision chart. Each of these flow together. But we start with the secondary research. We start with what's already out there, what's already known. That includes reviewing existing documents and publications, talking with colleagues and others in the communities, participating in GBV and livelihood coordination meetings, conducting market observations to see what men and women are doing in the market. Are there risks associated with what they're doing? Because the better the analysis that secondary research is going to help you draw, then the better the response. So the more data you have, the better the analysis, the better the analysis, the better the response. So I'm going to walk you through each of these subsequent steps. The safety mapping, and I know many of you are familiar with this, what we try to do is take this good tool and build on it. It's very basic. It asks people to basically draw a map of their community and then identify the places that are important to them for their livelihood. That might be the market, it might be the bus or the taxi stand, it might be one of the supply shops, it might be going to the nearby fields, to mark those places that are important to them for their livelihoods. And then, as a group, and again, you do this with disaggregated focus groups, disaggregated by men, women, older adolescent boys, older adolescent girls, you ask them, do they feel safe in those places? Never, sometimes, or always. And if they say never or sometimes, you ask them, well, what are those associated risks? Is it they're being taunted? Is it they're being touched inappropriately? And you figure out what forms of GBV they're actually being exposed to at those places. So for example, you might do a focus group with women, and they say one of the places they say is the market, and they might say they never feel safe there, that they get touched inappropriately by men when working in the market. So that's a form of sexual gender-based violence that you would then highlight and fill this out. And you would do this. There would be a row for this for every single livelihood place within the community that they have identified. Then you move on to the next part of the tool, which is the safety tool. And this helps you actually look a little, it takes you one step further. It helps practitioners identify factors that increase the risk of harm and violence, and more importantly, identify current protection strategies used by communities. Again, you do this by sex and age disaggregated focus groups, and you look at when. So what time? Are there times of day when the risks are higher? At nighttime, certain times of the week, you know, when everybody's off work on a Friday or Saturday, for example, or certain times of the year when nobody's working in the fields and men have a lot more free time. So what times are at particular risk for them? What situations, when they're selling by the side of the road, when they're going door to door to sell items, when they're alone in their shops, for example? And which relationships put them at particular risk? When they're dealing with a boss, when they're dealing with a supplier, when they're dealing with buyers, when they're dealing with an intimate partner. So what are those relationships? And you list the reasons why community members feel unsafe at certain times, in certain situations, and in specific relationships. And then you summarize those. What are the primary risk factors that come up over and over again? It may be, for example, walking to and from the market. And then you ask them about, well, what protection strategies do they employ as individuals? Do they have a protection strategy? Do others in their communities have a protection strategy? What are the strategies others in the communities use to protect themselves or reduce the risk of violence? And then finally, that final column on safety net, you're going to ask them questions, which I'm going to get to in the next slide. And those questions are those you see on your screen. And what you're asking them here is each of these questions, and if they answer less than 4 of them yes, that means they have a very weak safety net. If they answer 4 yes, that means it's probably sufficient. It doesn't mean they're safe, but at least there's a safety net in place. And more than 4 means they have a fairly strong safety net. Why is this information important? We know that social capital, that is social networks, are vital to safe livelihoods. And in your programming, if social networks and safety nets are weak, you want to think about how you can strengthen those. You know, women's cooperatives, women's savings clubs, that kind of thing. Finally, you move on then with this information to your decision chart, where you list your livelihood activities. So maybe it's giving loans to women to set up a small business. In the next column, you're actually importing the information you've already collected from the previous two charts that you've completed. Is there risk associated with that activity? Yes, maybe. If so, what is the risk? Yes, we're giving loans to women. They don't have a safe place to save it, and the men are using the loans, so that's a risk. Does the community have a protection strategy? Again, you're importing that from the previous chart that you've used. What are those? Is there a protection strategy in place? Yes or no? And then finally you go on to say, okay, we've identified that this livelihood activity has associated risk, and there's not a protection strategy in place, and yet I'm implementing that activity, so I need to develop a protection strategy. So how do I do that? You then engage in a consultative process with the target participants. So again, if this is women receiving a loan, you consult the women to review the potential risk of the activity, and you jointly develop a protection strategy, as well as identify which risk they're willing to take, because every livelihood activity will have associated risk. Finally, what I want to do, what I want to conclude my part of this presentation with, is to get to the point that we were trying to make in our research, which is that safe, dignified work may be the most effective form of protection. And we really believe that. And that's what we're pushing the humanitarian community and those economic programmers to do, because we believe that if you actually make economic opportunities safe, you can mitigate many of those negative coping strategies that were identified by Mendy earlier, the transactional sex, child labor, all of those kinds of things. That when people affected by conflict can safely earn money, they can provide for their basic needs, which means they don't need to sell their rations, they don't need to sell their bodies for money, they don't need to pull their kids out of school and force them to work, and that boys and girls have alternatives and other opportunities rather than just potentially joining armed groups. We believe that when families have steady, safe income, they can afford to keep their children in school, feed them nutritious meals, and ensure they have and receive appropriate health care. So that's what we're pushing for. And at this point, what we would like to do is to open it up for questions.
Yeah, and thank you both, Mendy and Dale, for walking us through GBV. And, Mendy, one of the things you were talking about is that it is a social problem, first and foremost, it seems, and, the sort of problems that we have in the response side of it is very well funded, and the prevention side, which is really where a lot of focus should be right now, because this is, a social cultural problem in a lot of instances, is not so well funded. And then, Dale was able to sort of walk us through livelihoods as a protection tool, and it's almost on the prevention side. Would you say that's fair to say, Dale?
Yeah, certainly what we're trying to do and to push the humanitarian community to do, which Mendy also referenced, was how do you think about prevention and how do you actually operationalize and program to enhance that protective environment? And we think safe livelihoods is one of the ways you can do that. If you remember the risk factors that Mendy pointed out, this is addressing some of those risk factors, like the lack of meeting survival needs.
Right. One of the questions that have sort of come through right now is just asking about if the mapping is done before implementing and in the design of programs. I know, the way that you talked about the tool, it seems to be a very participatory tool. So I think it might be interesting for our participants to hear about, when would be an appropriate time to use the tool, and, how you would use the tool in programming then and designing programs.
Very good question, and we look for your feedback on how you might use this. and we will tell you where you can find the tool at the end of the webinar. But certainly we would suggest you use it in program design before you start implementation. Obviously your participants may not, your target participants may not have all the information yet, but to at least have them think through what kind of risk may this activity expose you to. But even in programs currently being implemented, we would recommend that people do this to look at, are we having unintended consequences with our programming, and can we modify our programs, can we build in protective elements to actually make this program safer?
Okay, cool. And the questions are coming in. So just, I mean, as a follow-up to, you know, how to use the tool and timings and stuff like that in terms of using the tool, Amy Yockey, and I apologize if I'm not pronouncing names correctly, she's a PhD student at Tulane working on the needs of the elderly in post-conflict situations as well. So can the tool be adapted to bring in those needs as well? And I know this is something at the Women's Commission because we do look at population groups, like we've looked at people with disabilities, adolescent girls. So is this something that you can see incorporating within the tool?
Yes, and in fact I should have mentioned it. It's a very good question, Amy. What I should have mentioned while I was walking you through that is when you do the secondary research and you're gathering available data, that should actually inform your questions. So if your target population is the elderly and you do all the secondary data collection on what's already out there on the elderly within your target population, then you might ask different questions or modify those questions accordingly so you're adapting it to find out the information you really need.
Okay, great. Thanks for sharing on that. And I haven't actually seen any examples coming in so far from our participants, just a lot more questions, but I thought it might be good to sort of talk about examples where you guys have seen this tool used or you know of organizations that are using the tool. The Women's Commission obviously is, you know, we do applied research, so we're not actually implementers, but we're getting tools together for practitioners to use. So would you be able to talk about some examples from the field?
When we were doing the research that I mentioned in the camps, the Jijiga area camps in Ethiopia and Cairo and Kuala Lumpur, certainly examples came through. For example, in the Jijiga camps, one of the activities one of the NGOs was implementing was helping women actually start small businesses like selling biscuits in the camp, that kind of thing, going door to door selling biscuits to earn at least a little bit of income so they could supplement their food rations. And what they found is that, and what the women told us there, is they appreciated the extra income, but when they went home, their husbands knew they had it and demanded it. And if they didn't give it to their husbands, they would get beaten. So obviously this economic activity was exposing women to heightened risk of domestic violence in this case. So we asked the women, well, what would you like to see done? How can we make this safer? And they said, you know, if we had a safe place to save the money, we could put half of it there, our husbands would never know, and we could use that for our kids' education, whatever we needed it for, and we could give the other half to our husbands and he'd never be wiser. But we would have control over at least half of what we earned.
Brilliant. Thank you. And one of the other questions that we have coming in from Amelia Moore, and I know we've definitely looked at this at the Women's Commission, but Mendy, it might be good to hear from you on this, and it's about within GBV programs, both at the prevention and response level, what about the participation of men?
Yeah, that's a great question. I think we're learning whether from any aspect of dealing with gender-based violence in an emergency setting that we have to involve men and boys. We know that they are largely the perpetrators of gender-based violence, but we also have to recognize that we need their involvement in order to actually solve the long-term problem of gender-based violence. And especially within livelihoods programs, I think it's absolutely essential. We've had experiences where we have, if we've engaged the community from the very beginning, the gatekeepers, which are often the males in the community, from the beginning to help identify vulnerable women and adolescent girls from a variety of criteria, not just ones that have been exposed to gender-based violence, but ones that are also dealing with other vulnerabilities, they're much more likely to support the program from the beginning to the end. And they will actually help identify vulnerable girls and women and support them in the process, so that when they are knowing that we're investing in their income generation activities, they may adopt other protective mechanisms, such as making the market safer for women and girls to sell their goods or other things that will actually promote their protection and the success in that program. And they're also able to understand that this is something that supports families and the communities where they are living.
Okay, great. Thanks for that. It is absolutely important, and we cannot stress it enough that, in looking at GBV prevention programs, the involvement of men and boys is so very, very crucial. Given that a lot of our tools, at least at the Women's Commission, have to do with displaced and refugee populations, one of the questions coming from Sadia Malik is around incorporating marginalized, displaced women in GBV programs. I know a lot of times, even when I was working in the field, if you had people within a community that because of caste or they were minorities or religious minorities or whatever it was, the invisible people that we talk about a lot of times. So what sort of strategies would you say there are to make sure that they are incorporated within GBV programs?
That's a really good question, and it's actually sometimes a hard question to answer. It requires really adopting some innovative approaches in terms of reaching the people that are the most marginalized in society. Often when we engage with communities, we tend to go to the people that are easiest to access, the people that have more position and power in communities, the people that have had more privilege over time. And so we have to come up with ways of accessing those individuals that may not be part of the conversation, that may, especially for older adolescent girls, the girls that are actually at home, invisible because of all of their domestic duties. One way of dealing with this is to adopt measures to actually access some of those girls, those older adolescent girls, and ask them who they know is in a similar situation to them, or if they know of girls that are dealing with particularly difficult circumstances in their homes, because they know their communities well. So accessing them and coming up with a strategy with them to help identify times and places where we would actually be able to access those girls, because they know better than anyone how to access opportunities or what can make accessing an opportunity safe for them. Dale, I don't know if you want to add anything to that.
I think it's a really important point, because I think what we've also found or are learning is the women and girls who are most marginalized are the ones who are also most at risk. And so those with disabilities, those who may be ethnic or religious minorities there. And so we do have to figure out how do we access them and ensure that they are included in any of the prevention and response activities. Very good point.
Okay, and thank you both for that. And participants, people logged onto this webinar, there are some great questions coming in, and I'm trying to do my best as I can, sort of staying involved within the webinar and also looking at the questions. And I will apologize ahead of time if we don't get to all of them, but as many as we can, we will today. And we will keep this conversation going. At the end of this session, we will, I will direct you to our webpage. We're just starting this conversation. It would be amazing to sort of stay involved with everybody and keep sort of this discussion ongoing. Question has come in around the research and how the Women's Commission actually came up with the tools. So Dale, I'm going to direct this to you, and it was around what methods were used and what sort of diversity were you able to cover in looking at livelihood strategies while doing the research. And if you could just recap, because you mentioned Kuala Lumpur was a place that we had gone to, Jigjiga, and I think there was a third location? Cairo.
Yeah, and it's actually even that bit of research was part of a larger body of research. We started doing research just on livelihoods with conflict-affected populations about 7 years ago, where we went out actually to 10 settings around the world, urban, camp-based, and return situations, both looking at IDPs, refugees, returnees, to really help try to understand why economic programs weren't actually more effective and what we could do to help make them more effective. And so that was a larger body of research. It covered quite a geographic range and included a lot of qualitative research with the affected populations, lots of focus group discussions, lots of in-depth interviews, as well as with the UN agencies and all of the practitioners on the ground in these settings, and site visits to the programs. But in doing that research, the question emerged, well, when we create economic opportunities for women and older adolescent girls, are we actually exposing them to risk? And so we said, you know, if we're promoting economic opportunities for these folks, we need to understand this. And so we actually did a lot of secondary research on the link between gender-based violence and livelihoods. And interestingly enough, there was almost nothing out there, especially in humanitarian settings. There was a bit from development settings, which we culled and learned from. And so we said we have to unpack this a bit more in humanitarian settings. And that's where we did the 3 additional site visits. And again, much of the research was done with the affected populations themselves. How are you earning money? What kind of risk does that expose you to? How might we help mitigate that risk if we design those programs differently? Mm-hmm. And then we did trainings. We've done about 10 different trainings around the world with economic practitioners and GBV practitioners, bringing them together in the room at these trainings, and then culling and learning from them as well. What are your experiences? Have you thought about this? How are you doing this? And then the tools, obviously at the trainings we kept telling people, you know, how do you think about protection? How do you make sure your programs are safe? And the economic program people said, okay, we get it. And it's, you know, we haven't thought about it before, we get it. How do we do it? Mm-hmm. Can you help teach us how to do it? And that's where we decided, well, we need a tool. We need something. And obviously, many of you on the webinar are familiar with safety mapping. But we're like, that's not quite enough. We have to take that a step further. So we actually looked at everything we could find that was out there and then said, how do we actually modify that, take it a couple more steps to actually force economic program people to think, does my program put people at risk? And if so, are there protection strategies I can build into that?
All right. And sorry, were you done?
Yes.
Okay. But just, you know, one of the questions, and this is kind of a hot topic these days, and it's about the urban context. And I think it would be good for both of you to sort of respond to, you know, are there different challenges that we're looking at in the urban context when thinking about GBV? The question is actually from somebody working in Brazil from UNHCR, and it's just, yeah, I mean, how do we look at GBV and or livelihood strategies, programs, doing the safety mapping in an urban setting? What are the challenges? What are the differences?
Yeah, it's an excellent point because we've done quite a bit of other related urban work on livelihoods, and certainly the issue of exposure to risk of gender-based violence comes up over and over again. We did assessments in Kampala, Nairobi, New Delhi, Johannesburg, and every one of those situations, they were very high risk of gender-based violence. The risks are somewhat different. Again, it's kind of getting out into that public sphere, using public transportation, going to and from jobs, going to jobs after dark, being in informal workplaces where you're not protected from your employer and the other employees, where you're exploited in the work setting. And in many of these situations, because if you're a refugee, you may not have the right to work, and you're working in the informal market, it also means you don't have any legal recourse. And so you don't have a means of actually protecting yourself. So how do you think about it in those settings? And certainly in New Delhi, for example, some of the NGOs were thinking about that. And they said, you know, we're helping place people in these informal factories, but we're going to monitor them. We're going to do regular monitoring of every one of these informal factories we're placing refugees in. And no woman will get placed into a factory without at least 2 other women. So women are never alone in there with just in a factory full of men. And they do training on codes of conduct with the managers and owners of these factories. So it's just thinking about it differently, but again, very much talking with the community to figure out what are those risks and what are those opportunities they're accessing.
All right, and I think that's a great question, and a couple of you on this webinar have asked about the urban context, and so I think that answers that quite well. Did you want to add something to that, Mendy, or you don't have to if you don't want to? No?
I think Dale covered it well.
Yeah. So one of the questions, and I don't know if this is something we can answer or not, but I think it's quite interesting to think about, because at the Women's Commission we're always looking for feedback on our tools, on how to make them better, how to make them more user-friendly. So we have a question from somebody who works in the United States with African American diaspora, or African diaspora communities, it sounds like. And she's wondering if our tool can be adapted to global networks, because there's a lot of, I mean, other than domestic violence or other sorts of sexual violence that occurs within gender-based violence, there's also something around social networks and stigma that comes. So she's wondering, is there something around our mapping that we would be able to adapt to global social networks? And she's thinking specifically around Liberian communities in Staten Island, but it made me think about the importance of the diaspora community when we were dealing with the earthquake in Haiti, and what a big sort of, you know, what a big network that was, and humanitarians didn't really know how to engage with that. So just around that, if you have something to say.
I can't say that we've thought a lot about that, but we would like those of you who are participating in the webinar to actually look at, can you adapt this tool? Can you use this tool with the populations you're working with? I mean, we certainly know the diaspora communities here in the U.S., for example, face unique challenges in accessing the workplace, and they face discrimination. They may face different kinds of harassment, different kinds of abuse. Those working in hotels in New York, we're quite familiar with the kinds of abuse they might face in those settings, for example. So to think about, could it be used? Could it be adapted? Again, it's how do you use it to learn from the population you're trying to work with.
Great. And I'd like to really encourage the participants, you know, do get in touch with us. Do let us know if there are different ways of, you know, adapting our tool. If you've gone ahead and adapted it already and used it in different ways, you know, it would be fantastic to hear, because we're always looking for good examples to put out there for practitioners. You know, case studies and things like that are always really great for everybody to have, so that, you know, we can see what works and how to keep improving the work we do to assist the populations that we are out there to assist. I wanted to very quickly just read out an example that we have from a participant who's logged on from UNHCR working in Nepal. And she mentioned that she hadn't actually used the safety mapping tool, but she's got a good example of where they, I'm trying to read it off the screen, so just be patient with me just for a little bit. But basically they merged a vocational training program with a broader curriculum focusing on human rights, sexual and reproductive health, and available services in the refugee camp, in order not to just offer livelihood skills for protection, but also life skills. So the feedback so far that they've received has been positive. And, you know, she's very interested to see if this could be used for livelihoods programs, and interested to see if this can be incorporated in programs for men as well. So this touches on a couple of things that we've already looked at in this webinar, but, you know, fantastic to sort of hear that example.
And I think it highlights one of the points I referenced, which is that the importance of social capital and social networks. And I think anytime you bring groups together and start working on things like life skills, you're already starting to build that social capital. And some of the broader research we've done on livelihoods has indicated that social capital is even more important than human capital or financial capital in terms of success in livelihoods. It's those networks you can use to find jobs, to secure protection, to find shelter, etc.
Yeah, and that leads very much into the work that we've been doing with adolescent girls, actually, and it is about empowering and protecting and looking at those social networks, which is also related very much to the urban work that we do, where, you know, the social capital that we always talk about is so important and, you know, often not thought about because it's not something that you put money behind. It's, you know, it's something that it's relationship building, basically. One last question, because I am very, very aware of the time, and this is a very difficult one, and one that I used to really sort of struggle with myself when I was out in the field and a practitioner. A lot of the livelihood programs, this question is from Becky Higgins, and a lot of the programs that we used to do, or that, you know, we're used to doing, is putting women in livelihood programs, but they tend to be, you know, through either the informal economy. The wages that are earned are really not that high a lot of times. It's higher than what they might be getting. It's, you know, better than nothing in a way you can say. But is it enough money in order to stop them from, you know, calling on negative coping strategies? So it is, you know, that's one of the sort of issues to sort of grapple with and deal with. And I don't know if either of you had anything to sort of say about that.
Well, it's an excellent point, and it's true. And it's one of the things with our livelihoods work we've been trying to challenge the humanitarian community on. So often we've thought about livelihoods, especially with conflict-affected populations, as being a little bit of money in the pocket to supplement the food rations. We haven't thought about what livelihoods really mean, and livelihoods means it's sustainable and it helps you meet your basic needs on an ongoing basis. And are we really providing those kind of economic opportunities for people? And we often aren't. And so we really need to be thinking through about the kinds of programs we're offering, and are they leading to really dignified work and sustainable income? Because that should be our goal.
Yeah.
And this is especially important, I think, for women and older adolescent girls, as they already have so many domestic duties that they're responsible for. So we really have to think critically about the livelihoods options that we are able to engage them in. Is it going to be worth their time? Because their time really is taken over by many other chores and things. So we really need to analyze that and think about how we really are we giving them enough to meet those basic needs? And basic needs may mean different things for different people, and so we really have to look at that as well and think about what are those priorities for an individual woman in terms of taking care of herself and her family.
All right. Brilliant. Thank you. And I think that was probably a good question for us to end on. And I would like you all to know, people who are listening in on this call, that you know, we will try and answer all the questions. We'll make them available on our website, and I'm going to give you the page that will come up after this slide, but we'll leave this slide up for right now. I will talk about this, but thank you so much for all your questions, and we will get through them, all of them, and make sure that, you know, they are answered, so you can continue to keep asking them and continue to keep the conversation alive. One of the resources, there's the page, Stay Involved. So basically you can see that, you know, we do have this e-learning course that we were speaking about before. It's based on our intersection of GBV and livelihoods, and using livelihoods as a tool for protection. It goes through the safety mapping tool as well a bit. So you can sort of click on that on the right-hand side of the screen and be able to take that e-learning course. We also have links to all the reports that we've mentioned. We've got the actual report that was published in 2009, Peril or Protection, and there it is. Yes, there we go. And that's actually the guideline and the tools for how to do this. It leads you through it step by step. The safety mapping tool that Dale walked us through is actually inside this publication itself, and you can see that can be found on our website. And if the next slide could come up, then I can sort of, thank you for attending. So you can sort of give us, email us, let us know what your thoughts are, how you feel about the tools, what's going on with, you know, your programs, and how we can support you around that. And we would absolutely love to keep this conversation alive. That campaign page that we had up earlier, you know, you'll be able to find the recording of the webinar on there as well, the e-learning tool as we discussed. There's also a blogger series that we will have, and I saw a couple of the bloggers were actually logged in, listening on this. And if you would like to be involved in our blogger series, just shoot us an email. We're just looking for unique perspectives from people to sort of tell us their stories. If you have examples of how you might have used the safety mapping tool or how you've used livelihood programs as protective programs, we'd love to hear about that as well. And most of all, use the tools that we have out there. I think it's great that the Women's Commission does this sort of work. I'm not saying that because I work for them. I used to use their tools even when I didn't work for them. And yeah, and I just want to thank Dale and Mendy very, very much for agreeing to